I think that it'll be a slow drop, and I think that that slow drop will translate to being a real grind for everybody.
Over a year and a half into the COVID-19 pandemic, and Alberta experienced one of its worst months with the virus, a death toll not seen since the start of 2021. But October could be bad, if not worse.
We are seeing these very high daily case counts in the community, and we know that we're not testing everybody because the percent positivities remain fairly high, so we're still missing a lot of cases.
In spite of those missed cases, over 45,000 positive infections were reported in Alberta in September, a number neared only in December of last year. Back then, the third wave was peaking with over 700 deaths that month before vaccines were introduced. Last month, 259 Albertans died from COVID, the highest monthly count since January of this year.
Even though it's a younger cohort, we're seeing a lot of deaths, and we're seeing a lot of, really difficult, long ICU stays, which really create a lot of a burden on the healthcare capacity that we have as well.
Dr. Saxinger says Alberta daily case numbers may be plateauing, but that doesn't mean we are out of the woods.
Whenever you look at an epidemic curve, that climb up has to be accompanied by a climb back down. And so even if it is starting to turn, we have a lot of cases already baked in that will be coming into the healthcare system over the next few weeks.
Taking a look at Alberta Health modeling from September 2nd shows a high scenario projection just under 300 ICU patients for the last week of September. The medium scenario at roughly 175 cases. We are around the 250 to 260 mark. The BC COVID-19 modeling group's expecting cases in Alberta to peak in mid-October. Whether the peak has come or has yet to, Saxinger doesn't see our healthcare system back to a comfortable space for a long time.
There's a lot of stretched thin hospital services, stretched thin healthcare workers right now. And then as soon as we get through this, we're going to be facing a backlog of care that's happened because of the displacement of all the other care due to COVID.
In Calgary, Tara Overholt, City News.